Baik, untuk sesuai tema kali ini, Dongbang Medical berdedikasi hanya menghadirkan produk-produk estetika yang beyond high-end, inovatif, revolusioner, dan terpercaya secara ilmiah. Nah, di tahun 2025 ini ada yang baru nih, Dok. Dongbang memperluas portofolionya dengan menjadi bagian dari ZQ-II, sebuah brand yang dikenal dengan teknologi mutakhir seperti liquid PLLA dan HA serum, sebagai wujud komitmen kami untuk terus memimpin dalam inovasi global. Berikut videonya dong.
ZQ-II, new concept of medical skincare, past CE certification, approved by FDA, 100,000 grade GMP purification production workshop, 10,000 grade biological laboratory and stem cell research laboratory, owns multiple national invention patents, clinical use in more than 5,000 public hospitals, adjuvant treatment for millions of problematic skin patients. ZQ-II. ZQ.
Oke. Kembali diingatkan, Dok, untuk isi absensi dengan mengisi nama melalui link yang akan di-share pada kolom chat di bawah ini untuk memastikan nama sertifikat yang akan nantinya dikirimkan melalui email-email dokter ya. Oke, tunggu sebentar. And now, allow me to introduce our today's speaker, Dr. Gunwoo Kim, a global aesthetic practitioner and educator from Korea, a director of the Korean Society of Stem Cell Therapy, a director of Korean Society of Aesthetic Surgery, director of Korean Society of Filler Medicine. Wow, with years of experience, Dr. Gunwoo Kim will guide us through the science, safety, and superior performance of ZQ-II PLLA in facial rejuvenation. For all doctors who have questions, feel free to type them in the chat box below. Without further ado, please welcome Dr. Gunwoo Kim. Dr. Chris, the screen is yours.
Okay, thank you very much. Apa kabar? Am I going through well? Can you hear me well?
Yes, we can hear you well.
Okay, now I'm going to share my slides. Okay, and then see chatting message. Okay, got it. So let me begin our webinar today. Thank you very much. I understand today is Tuesday, so I'm sure that everybody is very busy at this time and maybe a little bit sleepy after makan. So I think I'll be just impact. I'll give you the essence. I'll try to make a very fun slides for your happy moment of this precious time. And I'm very honored to have this webinar with the Dongbang Medical Global. And thank you very much to the Mr. Roy for giving this opportunity to share our insights with global Indonesian doctors. So today is ZQ-II. I put this Dr. Strange because ZQ-II may be very new to us. But I think we are very familiar with the PLLA so far. If I may say, the Sculptra has been long in the market. But it's the PLLA, but as I mentioned, it's adding the mPEG. So it's a totally different application that we can easily use. So thank you to the Hera once again. If you see, I'm more focused on the stem cell therapy as well. But I have now experienced about 8 to 9 years in aesthetic field area. So I will explain what I have been through. And this is my clinic. So we're pretty much at the center of Seoul. Like I know you guys are familiar with the Gangnam, but more like we are in the Cheongdam area. That's where most the churches seem at, like all that the good brands or all this Apgujeong, Gangnam, and Cheongdam is where all these high-end markets is. So maybe like a Kumang probably would be similar area. The reason why I'm saying this is it's not a very like a factory like facility. We're we're like a more VIP clinic doing one by one. So which means my clinical philosophy, I would like to say, is that we, our clients, our patients want beautiful, of course. But as I said, cukup cantik untuk menarik perhatian. Ya, tapi tidak sampai Suhan uh, curiga. What I'm trying to say is, our patient don't want swelling. We don't want bruise. We don't want anything. We want a very natural look. So in our clinic, all the product is going heading toward our beautification. That is not very aggressive thing. So in that sense, this JQ2 will be very much matching because it's very easily done and it does not give a lot of swelling or inflammation compared to traditional skin, especially collagen stimulator, I would say. I've been in the Indonesia a long time, since like 2016, 23, 24. I was in the Muse too, this time as well, like a month ago. I was in the Muse 2025. Probably some of you I met already at the Muse session. So I went there for the stem cell, which is my area, and I also did the other PCL. In my clinic. I'm a training center for the PDLLA, and I wrote this article about this nasolabial area using KAHA. The reason why I'm saying is I'm not just met this PLLA MPG on the first day, and I'm not here today to share my ideas without knowing this PLLA, PDLLA, and PCL. So I've been using all this. We are still using it well, and I think there are different application for each product. But if we're talking about collagen stimulator, I'm sure in Indonesian market also the Sculptra has long been in the area. Olidia, same as Sculptra, and PDLLA, Lenisna or Juveluc, or now PCL. These are all the developing, including a radius from the Merge Kaha, including those things. Now, in 2 years, with like the last 2 years in Korea, from hyaluronic acid filler area, now it has changed to collagen stimulator market. The reason why, I think two things. One, these people, the patients, they are already have seen too many complications using HA filler. And two, they are tired of coming back and back again because HA originally, I mean, automatically, in our body, we have hyalase a little bit. So it will fade away eventually with like a 6 or maximum like a 2 years. You will be losing. So people are tired coming back to the clinic again. So in 2 years, I am actually about from the HA to this collagen stimulator area, about 80% are now I am using collagen stimulator. So if you have used lots of collagen stimulator, anything if you were used, the main concern about this collagen stimulator is always about nodule. Any other than then, probably swelling because of the a bit of inflammation. Well, that's normal, but that's treatable. But this nodule thing is very tricky to deal with. And then always, as the director doctor of my clinic as well, I always concern my junior doctor would go with the treatment as well. If you see the slide on the left side, This is correction of facial lipoatrophy, like a sunken cheek in AIDS patient. We all know this HIV reduces our immune system, so almost like an immune deficiency, right? But these collagen stimulators are always has to work with the immune thing only. But what I'm trying to say with this slide is even though there is a minimal immune system having, if you look at this guy, it's quite all right with the PLLA. So PLLA is quite working well with as of collagen stimulating and volumizing our faces. But always, as I said, if this on the right side, nodule and granuloma will be always the number one side effect that we are thinking while we're using these collagen stimulators. I think actually why nodules are coming up, why granulomas is happening is because of the dilution. I will deliver about this issue. Well, nodule itself did not do wrong anything. I personally believe the doctor who has been put this whether collagen stimulator, if there is a more than needed area, more than amount of something more at one point, that will eventually draw more macrophage. It will draw more collagen. And then from superficial look, if patient we see the mirror, then there's a bumpy ones, then we call that nodule. So actually it does not has to do wrong with the product. Probably, mostly, I would believe that the amount of the quantity that we have put there would be wrong. But how? Why? We think we mixed well, right? So, but this note, if you, I'm not sure that today, how many of you actually have suffered by dealing with the patient by making such nodules. If you're making nodules with the PDLLA or maybe very much diluted PLLA, it's better. It's more solvable. You use normal cell line. We use HIFU. We use a thermal the device to make more swamped and the heat energy, and we actually break it through with the cannula and the HIFU energy. Then possibly this things can break away. So I've treated several nodules as well. But if you happen to meet with the CAHA, the calcium nodule, oh, that's really tricky part, and that is almost like a surgery part later. So just for
Doctor,
example,
please, sorry, I'm
hmm,
jumping because the screen is looks so small. We have
oh,
to,
oh
yeah,
really?
okay, yeah, it's a some block area from this presentation, and so many doctors notice
Can
it.
you see well?
Yeah. Oh no. Wait. Yeah. Can can we share the presentation to help
Uh,
you from here, doctor?
uh, Maybe so. I send you my slides.
Okay. Is it already blocked all the screens right now?
Oh yeah, yeah. But is it working now? Can you see?
No, it's not working well right now. I'm so
Oh,
sorry.
wait.
Dokter, kami minta maaf. Kami akan refresh dulu sebentar ya. Mohon ditunggu.
Still not now working?
Yeah, there is a black block on the screen.
Well, this one.
Yes.
Still
Is it
Sam
is
Doc.
it okay?
We cannot see
Okay.
clearly.
Is it
Yeah.
okay now?
No,
Still, there is a
no, still
black.
block. Even worse.
Is it okay now?
Wait.
Still not full clear.
In the down. Yeah. Okay, that's an application, I think.
So can you see the screen? Cannot?
We can see the description, but still
Mm.
there is a black box on the
On
corner.
on on upper
Yes,
side, right?
yes, right.
I don't know how to get rid this.
I'm sorry to bother you, Dr. Chris.
No, it's okay. It's okay. How about now?
That's in the corner right now. Ah, okay, that's a lot of better.
Okay, it's much
Sudah
better.
terlihat ya, Dok ya? Baik,
Now okay?
Yeah,
bisa dilanjutkan. Thank you,
it's okay
Dr.
now.
Chris.
Okay, okay,
That's
okay.
a
Thank you
well
for
presented.
sorry for
Yeah.
the delay.
Okay.
So now good to go, right?
Yeah, you can continue as well.
Okay, okay, okay. So for example, if you see a Sculptra which has been long in the market, it has this. If you see sterile dry powder, PLLA is in the dry powder, and it contains about 150 PLLA and sodium carboxymethylcellulose and mannitol. Other than that, I would like to just focus that there's a PLLA, a sterile dry powder. So you need to mix it. I'm sure you have done long time. I always do this like a 1 day ago. I always ask my nurses as well. And then even before I use it, I try to mix it more. But the key point about PLLA is hypophobic. It does not like water. It's not friendly with the water. So if even we think we can mix it well, if you just take it like and leave it for 3 minutes, you can actually see that powder is going down. So this is a real problem with the collagen stimulators. So much you're trying to dilute it with the water, it may seem that it is diluted because, but eventually, because it's hydrophobic, it seems it's a mixed well, but it's not. It's just a mixed like. It's a just a having portion. So which means when we are trying to use either needle or the cannula on this face, this area and this endpoint, the distribution of the PLLA may not be even. That's the real point that I would like to deliver in diluting system. Even if we try hard, this amount and this amount, we never know which area will be more densely powder is there. So even though we use very small amount, a certain area could be unluckily maybe a nodule or a granuloma if there was more than we were expecting. So for if I present our ZQ-II, it's also PLLA. If you see, it has more PLLA actually in one syringe compared to the Sculptra, and actually contains about 250 milligram. But the different thing is, it's not just the conventional PLLA. It is at its tail. Actually, it's not a tail. As a cross-linking, it has this mPEG thing with the PLLA. Why this cross shape is very important is, as I mentioned, this PLLA on the left side, it does not like water. On the right side, mPEG, by putting it, then now the PLLA can be able to water soluble. So that's a really different part. And then it becomes about 11,000 Dalton. Why 11,000 Dalton? You don't have an idea right now, but it's very, very low volume of Dalton. Usually, when we pee, when we drink water, it goes to the our kidney, and we say that renal extraction. So the renal extraction is generally considered safe if the size is under 40,000 Dalton. So if we're talking about 11,000 Dalton, which is PLLA and MPG link, it will, even though it degrades, yes, Is it okay?
Okay, doctor.
Okay, okay, I'll continue. So, yeah, even though it degrades from the 11,000 Dalton, it will, if it degrades, it became smaller, obviously, and then it does not have risk of granuloma or delayed nodule or long-term inflammation because it will go well to the kidney. So I put this comparison. I think you can capture this screen too. Uh, I'm not just trying to saying the bad words, the other product. It does have their own application. But comparing with the Sculptra, it's very big Dalton. It's a very molecular big size. Even though they say it's a limited, very small one, of course, among this molecule particle, I think it's small, but still compared to PLLA and PEG, it's quite bigger. So on the right side top here, if you we already know that this delayed nodule granuloma and uneven particle distribution is a problem when we're using not just a Sculptra, any share my screen again. Can you see it?
Can you share it again, please?
Okay, got it.
Okay. Okay.
And I'll
Okay.
okay.
The black box on the center still fit there.
Can we see?
Yes, we see clear. Thank you. So sorry. Yeah, you can continue the presentation, Dr. Chris.
Okay, okay, okay. So if you see on the right side here, I delivered. It's compared to Sculptra, right? It has 11,000 Dalton. So itself does not have meaning, but if you're thinking about the size that things are going well about up to 40,000 Dalton through kidney, so this uh, thing is will be even though it dissolve in the body, it will go well. It will disappear well in the from the body. So, sorry, this is a function of a PLLA and MPG. PLLA will work as if Sculptra originally. The macrophage will come and then it will form the collagen. On the right side, it will release lactic acid. So both things, it will be tightening skin and it will lessen pigmentation. But with this thing, I think original PLLA, PDLLA, or any other collagen stimulators are doing well such a thing similar. I don't think this will be like a very advantage thing about PLLA, MPG, or JQ2. Uh, Once again, here, after PLLA and MPG is absorbed in the skin, now it will be moisturized. So you can feel the moisturized version. And of course, as if like any collagen stimulator, it will activate type 1 or 3 collagen. And then later, it will stimulate this fibroblast to rebuild this dermis level to have this uh, tightening effect. About precautions, always about inflammation, I think. Not just the JQ2, but also Sculptra or the PDLLA, anything. So it should be forbidden for those who have this allergy and also of course not skin tumor or diseases like. And I've been had a trouble with the collagen stimulator, very much swelling. When I didn't know, but I and later I found out that she was under big disease. So she already have much this inflammation inside her body, and then we put more collagen stimulator, and then it got more this inflammation obviously, and then she got swollen so much. Later I had to use so much of a steroid and other this lymphatic drainage devices to make sure that it does not have swollen faces. But so for JQ2 as well, precaution thing should be about inflammation. So I also brought some slides here. On the right side is the traditional collagen stimulator. On the left side is this nanoparticle collagen stimulator, or we call this JQ2. On the right side, if you see that this is the so-called collagen stimulator. Let's say it's a PLLA fragment. So it goes in, because it's big, these macrophages cannot eat it. So it will just stay around this PLLA, and then it will just circle around that the PLLA, and it will make collagen around that PLLA. So it will give collagen, and it will give this volumization effect. For the nanocytes for foreign body, because it's so small, macrophage can still eat it, but it cannot digest. So it will make from the inside of a macrophage, it will grow up, the collagen will be stimulated, but when the macrophage dies, it will take out the nanoparticle again. So that's why it is not very severe volumizing, or it will not give a lot of inflammation, but it will give very long-term effect as well because of this reason. So sorry about this Korean thing. So polymer goes in, this is macrophage, and then collagen around circle. This is traditional collagen stimulator. But new one, a small particle, the macrophage will eat it, and then macrophage from there will allow the collagen. But once the macrophage die first, this particle will come again, and then rebuilding collagen again. So it's very long-term thing in a very safe way. So I compared this microparticle and nanoparticle around. So spreadability, of course, it's already there. You don't need to dilute. It's already in the syringe. So it's very uh, evenly distributable. And about nodule, that I think this is a really key point of why we're using the JQ2 is that we don't really need to care about this nodule because it's well already distributed. You just need to know where, in what depth you are going to treat the patient. So collagen stimulators uh, for the PLLA, as you saw, there's a particle and then macrophages. It will gradually build up, and then it's quite well with the volumizing. So nobody can deny it. It is good for volumizing actually, but always if too much of a volumizing at one area, it will become nodule, and then later, even if we don't know, but maybe under our body goes very under the weather, not good condition, then the inflammation will come again, and then granuloma will be happening. So that is a really risky part of the traditional collagen stimulator. But with the mPEG at the tag, that it will be very uniform. So all this area, it will be very evenly distributed, stimulating the skin. So this is the video that I did with the injector. This is needle injector right away. So so for the process, I think we can do the needle, or we can do the needle injector, or we can actually use cannula as well. And nowadays we're using the air jet or Synerjet in my clinic. It's using well. So I'll show you later. So this is right away after using JQ2 with thing. It doesn't have much swelling. It doesn't have a bruise, obviously. It doesn't have a downtime. So your patient can just go right away after the treatment. And I also did a needle injection. It's doing well. It's fine. It's injectable. And uh, for more application, because I do the stem cell as well, mixing with the stem cell thing and plus any other solution is allowing this more vascular angiogenesis more, so it will make less inflammation in a bad way, and it will make a good environment for whatever the source of use you use into the body. So what I do is usually I mix, we use that hematopoietic stem cell kit. I take the stem cell and then we mix it with JQ2 or the any other skin boosters as well. And I use with the Synerzen, which is non-needle air injector from outside our superficially. So this is actually the one that I
Synergen, this is device that
fitted.
can deliver drugs without needles. So it's very easy to use, and then it goes well with the nanoparticle skin boosters, I assume. So I just mixed it with the my plasma out of my blood, and then I mixed it with the JQ2 that I am going to deliver this to my face only. So
So if you closely see,
like if I just shoot it.
so air pump just to shoot it superficially, and then it goes to the dermis area as well.
It gives very high speed energy to shoot from the surface, and then it without any needle it goes into the dermis level, which means this has electroporation function as well, which means it allows more to absorb the dermis level while we're doing this shooting thing. So it's a bit ticklish too, or I would say a bit pinch as well, but it's still it's good to go. And then I am very sensitive to pain, so if I'm recording this video without actually frowning so much, this pain is very reasonable to me. So I'll finish with on the right.
So right away with the injection, if you compare left on the right side, you don't see much of swelling, you don't see the redness, you don't need the actual needle to risk all that the vessel bruise or the swelling thing. And then what I want to say is
Lock syringe, the because the lock syringe you can just put it in to the Synerzen. The reason why I showed mixing with the plasma is to show more application in accordance with stem cell, which is more trendy one. Synerzen.
if you don't want the mixing thing, you can just put, because the lock syringe version, our JQ2 is, you can just put it there and then shoot it right away without the needle. And then
Synerzen, 100% liquefied with the mPEG. So PLLA should be very, very safe and well distributed in the syringe already. So we don't need to worry about the nodule thing. And then, which that means whether you do it or I do it, we can expect very standardized level of quality of the skin booster.
the last word that I mentioned, this, by the way, this is the CE from the your Indonesia that is good to go to use in the Indonesia. So to wrap up, I want to say that 11,000 Dalton is just not a number. If you now have a notion that how small that particle is, and then the really another important point is you do not need diluted. It's already there. So it's good for the performance. Safety is there because we don't need to mix it, and then there's no chance of the this bacteria or the septic thing can be intervening. It's very convenient. You can just take it out, just put it in the Synergen, or you can just put 30 gauge needle or the cannula right away. You can use it. So my summary key message is it's very easy to use, safe one obviously, and then it's already syringe there. You don't need to mix it, so you can just take it either whether you use a cannula, needle, or injector, or maybe the trend, the synergy or the energy, any product would be fine. Putting this liquid to the dermis from the air pump. So function is two things. We already know how PLLA is good. So the worry about the PLLA was the nodule or granuloma. But by putting this MPZ at the end, it will give so much powerful function as if PLLA do. But it will be carrying, MPZ will allow that there will be no much, too much flame within the skin. And also like other nonapeptide, tranexan, tranexamic acid will be just other like a function for making the skin more bright. So I think the key important uh, using is about the dilution. You don't need to dilute, you can just stimulate. And I mentioned about whether you are using or I am using, you will be giving same standardization level of the screen quality result. I also have two our junior doctors. When I fly to other area, or if we're using our like a KAHA or the PDLLA or any other HA, I actually worry whether my team will be doing well or not. I trust them, but I still worry. So that means other collagen stimulator or this filler area, there are a certain level of technique that should be done. And probably you would agree with that. But this with the JQ-II, because it's already there and you can just easily put it, then it's mostly nodule risk free. Then what else can be more concerned? So in that sense, I think this is very good product that came out in the market. Maybe it will not be very powerful so much as PLLA itself, but risking that much of PLLA would be non-appreciable in my clinic. As I mentioned in the very first slide, that we don't want like superpower on the face. We just want a natural look, stick it, better beauty, but better than yesterday, without any bruise, inflammation, or swelling. Just natural look, natural lifting, natural good result. So that's why I would like to share my ideas with you doctors today about JQ-II, and I wish you to see in the Guangzhou soon in China. Thank you very much today.
Eh, for the amazing presentation, Dr. Chris. So, untuk dokter yang punya pertanyaan bisa raise hand atau langsung ke chat room aja. Apa ada yang mau bertanya? Silakan. Oh, sambil mengingatkan juga, jangan lupa untuk upload keseruan webinar hari ini dengan tag dua Aji Dongbang, yaitu dongbangmedical.id dan juga ZQ-II.id. Dan dapatkan special hampersnya untuk dua pemenang dengan konten yang paling menarik ya dok ya. Ada pertanyaan lagi kah? Oke. Oke, dari Dokter Citra ya. Oke. Dr. Chris, there is a question from Dr. Chitra. How the rules for mixing with lidocaine?
Lidocaine. I actually got a shot on my face, but it didn't hurt too much. So I don't think you actually need to mix with the lidocaine. It was okay.
Okay. There is another question from Dr. Orlan. Can this product induce AAC?
Can this product? I have this
Induce
power.
AAC?
Sorry, what's AAC?
AAC.
Oh, the stem cell. Yeah. Well, actually, not just with the JQ-II. I recommend all stem cell mixing with any skin booster or HA filler or anything that I think it's good. Mm.
Okay. There is another question from Dr. Yustera. Sorry. Um, so this is for more like for their target, right? Or just for polymerizing?
So if nodule happens, what do we do? In Korea, maybe in Indonesia too, now want to, after COVID-19, there has been a long time now, collagen stimulator, the PLLA, KAHA, Jubilu, PCL. So the control of the nodule are already standardized, I think. We have so many protocols, but simply with the JQ2, I cannot guarantee that there will be no nodule, right? But I think it's a minimized with the MPG, once I said. Even though if the nodule happens, then we go to just the original traditional way to fight with the nodule. Why nodule? I think it's two different things as I showed you in the slides. Usually with the bigger, like a PLLA particle, these macrophages cannot eat it. So around it, the macrophages there, around it, there's a collagen, and the inside, there's still this particle. So this either PLLA or PDLLA, the important thing is to break it down, to make a pore into the hole with that particle. So it will be three things. First, putting water, like a normal cell line, as if we're diluting, uh, change it to the diluted situation. So we put the normal cell line there and then make very soft. And then two, we give it energy. If we give energy, it will be dissolved more efficiently. And then we can try also the steroid a little bit. And also we can heat it actually with the like a physical power with the HIFU. That is the way we deal with the nodule. I think with a nodule, whatsoever product you're using, if you met nodule, I think probably same procedure. But as I mentioned with the Kaha radius, I don't, I'm not just saying just to degrade about the Kaha, but with the calcium nodule, it's really hard to break because it's really calcium. So most of the times, uh, need us actually cut and then take it out. So for the radius, I really do not go this periorbital area. I only use radius, nasolabial or this extended part. I don't use this periorbital part with the Kaha because uh, like if we have this nodule here, I think it's okay. Some dot here, it'll be okay. But people do care about this eye areas. So if we have nodule here or there or here, because people to people, when we face each other, this is the most like a sensing part. So people are concerned about this periorbital area nodule pretty much more than this area of nodule. Sometimes this area, they just, it's okay, it will fade away. Of course, it will fade away later. But this, once you deal with the nodule, this periorbital area, then you need to really be good with the patient relation.
Okay, maybe there's a lot of question right here. Maybe
Right.
we can choose the maximum for now. And how long
Mhm.
from Dr. Aini? This question is how long the effect from ZQ-II PLLA and PEG can stay in our face or body, and how many times usually we can repeat the treatment to get maximum result on our patients.
Well, I have to very honest with you. I also met this product recently. So I haven't long used this JQ2 for a long time. And actually, that's why the reason I'm going to this Guangzhou to meet actually the producer of this product. JQ2 PLN MPs can stay in our face or body. How long? But I think it's long, as much of the PLLA, but it's the diluting slowly, and then it will last longer than PLLA. Why? Because this nanoparticle can be eaten by macrophage. So as I said in the slide, it will come again to the outer side when the macrophage is dead. And then it will re-stimulate. It will not be very much strong because it's a small particle, but it will come out again out of from the macrophage, and then it will little bit re-stimulate. So I think it will be longer than PLLA. And how many times usually we can repeat? I think that's depending on whether you want to just put on the superficial or the cannula or to the deep inside. From the outer side, I tried it now 3 months. I got this, including today. Now I can even feel very smoothness. So if we just want to very easy-going skin booster to make very even surface, I think this will be good. But I would not use. I don't. Now I'm just giving you a very honest my opinion. I will not use HAQ2 as volumizer. I will not go with the nasolabial fold with the JQ2. I will actually go use a radius or the any real PLLA because I need more stronger power. This one with just lifting a little bit or the pores on the superficial skin that I want to just not like a super power, but still good power, but very in an easy way without any risk of nodule thing. So,
Okay.
how many times will we repeat the treatment to get maximum result? Well, I think it's a come and go, come and go. So I'll try to use. I'll just say to the patient, you will instantly have this good facial skin, but if you have some trouble, come again. So I might use just like every 3 months to if you want to just one patient to long time, I might try uh, every 3 months. Have you mixed the JQ with any product such as botulinum toxin or other? Why would you like to mix with toxin? I don't think it's a good. I don't actually mix with anything with the toxin. So I don't think it's a good idea. I think the originality is always important. I showed mixing with the plasma. That's not another product. Plasma is your buffy coat where that stem cell is. Uh, the reason why I'm saying the plasma is that was just a PRP kit. So I wouldn't say it's a stem cell, but in the PRP, in the plasma, there's many growth factors, VEGF, EGF, such a thing to help that area to enhance. So I was mixing my blood with the JQ2, but even other thing like other Trivelo or the radius, I don't mix with the toxin. I don't think it'd be easy way, but I don't think mixing with the toxin is not a good. Mm. What suggestion after treatment
Okay.
user patient?
Okay. Because our time is out. Are you still wanted to continue the Q&A? It's okay.
Oh, it's 5 p.m. already. Okay.
Yeah.
Then if I may, can you all
Yes.
capture this the question
Sure.
and I answer
We
one
will
by
collect
one and then and
the
then and then send you back.
we will collect the
Mhm,
questions for
mhm.
you, and dokter,
Yes, yes.
kita akan kumpulkan dulu untuk pertanyaan-pertanyaan dari dokter ya. Nanti akan dijawab langsung oleh Dr. Chris by online. And all right now let's take a group photo before we continue the webinar. And
Sure.
dokter,
I need
yeah,
this. This is
please
our
dokter.
VIP room with the heart.
Oke, untuk
Okay.
semua dokter bisa turn on kameranya untuk kita ikut berfoto bersama ya. Oke. Sudah. Oke, kita ada style dok untuk seperti ini gayanya, bisa ZQ-II.
Okay.
Can you do this?
How do we
ZQ-II.
do that?
The left on the right, on the up, and then the right and the down. So, like this one. This one. Yeah, you can like this. No, no, this, this one, this one.
You should
Belum,
teach
belum,
me
belum.
well.
Okay, okay.
Okay.
1, 2. Udah, Nan? Lagi? Okay, 1, 2. Freestyle.
Got it.
Yeah, you can freestyle this. Okay, okay, so, okay.
So demanding.
So sorry. Yeah, thank you so much.
Yeah.
Okay, okay, again, again.
Okay.
Thank you, dokter. Kok aku tuh? Okay, thank you, Dr. Chris. Thank you so much for answering and joining us today. You may now can leave the Zoom session. We are so grateful for your time and sharing. Wishing you a great ahead, great time. Thank you. Oke, Dok. Jangan khawatir, jangan sedih. Dokter Krisnya udah nggak ada, karena dia harus lanjut kerja lagi. Nah, sekarang waktunya kita seru-seruan ya, Dok ya. Kita akan main mini quiz dengan hadiah yang menarik, yang pastinya akan dipandu oleh rekan saya, Mbak Ludian dan dia. Silakan.
Oke, terima kasih Mbak Hera. Oke, Dok. Sekarang kita masuk ke sesi kuis ya. Dokter masih pada semangat kan? Ini kuisnya berhadiah, Dok. Oke. Untuk join dalam kuis kita hari ini, dokter boleh join melalui link yang sudah di-share di kolom chat. Jadi nanti dokter tinggal langsung jawab aja. Siapa yang paling cepat dan tepat akan mendapatkan hadiah. Oke, sudah ready?
Ready?
Oke. Bisa kita mulai, Dok?
Oke. Kok nggak ada suaranya?
Ya, oke, Dok. Sudah ready? Kita langsung mulai aja. Untuk pertanyaan pertama, kapan perusahaan Dongbang pertama kali berdiri di Korea? Oke, dokter. Langsung jawab. Tadi udah ada kisi-kisinya nih, Dok, di presentasinya Mbak Hera. Oke, kita lanjut ke pertanyaan kedua. Kapan perusahaan Dongbang pertama kali berdiri di Indonesia? Oke, dokter bisa boleh langsung jawab. Oh, pertanyaan ketiga, apa saja core ingredient dari ZQ-II? Oke, pertanyaan keempat. Apakah penggunaan ZQ-II perlu didilusi? Nah, ini pertanyaan terakhir, siapa speaker kita pada hari ini, dokter? Boleh langsung dijawab? Nih,
Kim, dokter Kim.
3, 2, 1. Oke. Wah, benar semua. Aduh, ada yang salah. Gak apa-apa, dok. Oke. Selamat kepada pemenang pertama kita, Dragon Knight. Yang kedua ada Dokju. Dan yang ketiga ada Dokter Andita Garindra. Oke, untuk dokter-dokter yang sudah berhasil jadi top 3, boleh hubungi tim sales kami atau nanti boleh kontak ke tim marketing juga untuk kita kasih hadiahnya nanti. Oke, terima kasih dokter sudah mau join kuis kita pada hari ini dan akan saya kembalikan ke Mbak Hera.
Sorry, akunya masih ke-mute ya. Maaf, maaf, maaf. Tadi selalu excited lihat dokter-dokter yang semangat banget ya. Oke. Untuk setelah kita udah bermain-main nih, kita selanjutnya akan ada marketing update nih, Dok, yang akan disampaikan langsung oleh Ibu Dinda selaku Head of Marketing Dongbang Medical Global. Silakan Ibu Dinda.
Ya, terima kasih Hera.
Sama-sama.
Oke, terima kasih dokter semua sudah masih stay di sini ya setelah tadi kita sama-sama mendengarkan presentasi yang menarik sekali dari Dokter Chris dan insya Allah bisa menambah kebutuhan ya terutama dalam praktik dokter semua gitu ya, menambah informasi dan juga pengetahuan. Baik, saya mau update mengenai marketing update di Dongbang Medical Global. Tadi Dokter Chris juga sempat sedikit mention ya, sampai ketemu di Guangzhou. Memangnya ada apa sih di Guangzhou? Nah, oke, jadi saya mau share ini dulu. Ya, jadi ternyata Dongbang ada trip ya, namanya Dongbang Voyage Guangzhou ZQ-II Explore China di bulan Agustus nanti tanggal 21 sampai dengan tanggal 25 2025. Jadi kemana saja nanti aktivitas ini, yaitu A Journey of Aesthetic Discovery Through, nanti ada ke Guangzhou, kemudian ke Zhuhai, dan feature-nya apa saja, akan ada Global Summit with Medical Experts, ya tentunya nanti akan banyak sekali manfaat di sana, di mana dokter akan menambah pengetahuan dan juga melihat wawasan yang lebih jauh lagi mengenai produk-produk terbaru, terutama di bidang aesthetic beauty. Kemudian immersive clinic visit, live hands-on training, cultural exploration, and unforgettable moments at Chimelong Ocean Kingdom and the Pearl River Night Cruise. Ya, jadi langsung saja saya mau ajak dokter lihat kira-kira pengalamannya akan seperti apa di sana.
Masih di mute, Mbak. Masih di mute. Sorry.
Ya, dokter. Jadi tadi semua itu adalah aktivitas nanti dengan Dongbang Voyage Guangzhou bersama tadi dokter-dokternya sudah ada semua di sana ya. Mungkin nanti dokter yang belum bisa ikutan untuk Dongbang Voyage juga nanti akan ada lagi sesi berikutnya, yaitu Dongbang Discovery Perth Beyond Aesthetic Australian Aesthetic Symposium AAS August 21st. Ini nanti di tahun 2026 Beyond Aesthetic Dongbang Discovery Perth 2026 and immersive. Jadi nanti 6 hari experience where innovation, education, and inspiration converge. Kemana saja nanti pada saat Dongbang Discovery Perth itu nanti akan ke Australian Aesthetic Symposium atau AAS, kemudian Global Insights, Expert Panels, and the latest in the PLLA and HA innovations. Kemudian juga nanti ada hands-on training and clinic visits, learn directly from top Australian practitioners, kemudian business and practice growth session, kemudian juga nanti akan ada strategic insight tailored for doctors. Kemudian nanti kita juga akan ajak dokter lifestyle dan networking untuk wine testing nih di Margaret River Coastal Exploration and exclusive gatherings to advance your expertise, expand your global network, and experience the future of aesthetic all in one, dokter. Extraordinary trip. Nah, dokter yang tertarik semua, silakan hubungi tim sales yang tadi kebetulan kami sudah share di kolom chat ya di sana. Jadi nanti untuk dokter yang tadi sudah jadi bagian Dongbang, mau mengikuti Dongbang Voyage ke Guangzhou, ya nanti kita clinic visit ke factory-nya juga bareng dokter Chris ya. Kemudian bareng trainer-trainernya Dongbang. Dan untuk nanti tahun depan kita bisa dokter bisa ikut bareng ke Dongbang Discovery Perth. Hubungi sekali lagi tim sales dari Dongbang Medical Global. Oke, terima kasih dokter. Dan sekiranya sebelum saya akhiri untuk aktivitas atau webinar pada hari ini, saya kembalikan dulu ke Hera. Sampai ketemu lagi nanti untuk sesi webinar berikutnya.
Oke, terima kasih Bu Dinda. Jadi nih dok, untuk nanti yang ke Guangzhou itu masih bisa pendaftarannya sampai Jumat ini ya dok ya. Nanti bisa dihubungi ke sales teamnya masing-masing per area. Seperti itu. Nah, gak kerasa nih kita udah di penghujung acara. Terima kasih untuk partisipasi semua dokter yang telah mengikuti hingga akhir. Jangan khawatir, e-sertifikat akan dikirim via email masing-masing dokter ya. Yang penting dokter mengisi feedback form dulu. Nanti kita akan collect untuk datanya dan langsung akan dikirim sertifikatnya ke dokter ya. Terima kasih. Sampai jumpa di webinar selanjutnya. Kami mohon pamit dulu. Bye.